Begin tonight with that breaking news out of Washington regarding the future of health reform. Just moments ago, Democratic Senate Majority Leader Harry Reid stood before cameras at the U.S. Capitol to announce a breakthrough of some sort on health reform.
I think it's fair to say that the debate this stage has been portrayed as a very divisive one, and many have assumed that people of different perspectives can't come together. But I think that what we were able to work out the last few days, which culminated tonight, belays that fact. We have a broad agreement.
We have a broad agreement. As to what that broad agreement is for? Well, the Associated Press reporting within the last hour that Democratic senators have reached a tentative deal to drop the public option. Quoting from the Associated Press, to drop a government-run insurance option from health care legislation that's now being debated in the United States Senate. However, Reuters just reporting within the last just couple of moments, literally since we started the show, that Harry Reid says reports that the government-run public option had been dropped were not true. So the AP reporting that the public option is dead. Reuters quoting Harry Reid saying that the public option is not dead, or at least that reports that it had been dropped already were not true reports. As yet, this remains unclear in terms of what the plan is that Democrats have agreed upon. But what is true is that after months of arguing about the public option and the White House de-emphasizing the importance of the public option, even as the president said he supported there being one, the policy itself, the policy of the public option, got negotiated over the last few months down to an almost unrecognizably weak proposal. We've talked about this on the show in the last few days. Now, again, according to the Associated Press, the public option appears to be dead. Senator Reid reportedly telling Reuters that that's not the case. Senator Reid denying the complete death of the public option. We did report yesterday that Senator Reid is the person who had tasked a group of 10 Democratic senators, liberals and conservatives in the Democratic caucus, to come to some sort of compromise on the public option. We don't yet know what the character of that compromise is, but if the public option has been traded away, if it is dead, what could replace it that would keep progressive senators happy? Two proposals are reportedly being mulled over by Senate Democrats right now. One is the idea of making Medicare, the program that serves older Americans right now, available to less old Americans, available to more people, possibly lowering the eligibility age from 65 to 55. Another possibility would be some sort of government negotiated plan that would be run by private insurers. Again, the big news tonight, though, is that a gang of 10 Senate Democrats have reportedly reached an agreement on health reform. And that agreement, whatever it is being sent to the Congressional Budget Office for scoring. When the CBO scores something, they talk about what the effect will be on the budget, on the deficit, what the fiscal impact would be of a proposed policy. The Associated Press reporting that this agreement would drop the public option from the bill. Reuters quoting Harry Reid saying the public option would not be dropped. This news breaking right now, not at all yet clear, but joining us now to help shed some light on what's really happening is Independent Senator Bernie Sanders of Vermont. Senator Sanders is a member of the Senate Health, Education, Labor, and Pensions Committee. Senator Sanders, thanks for joining us tonight on such short notice.
Good to be with you, Rachel.
Help me understand what Senator Reid was trying to communicate tonight. Is the public option still alive?
I wish I could. I think the truth is CBO is analyzing the numbers on this. I don't think anyone is very clear as to really what is in this package. But let me be very clear. What I have said repeatedly is we are starting with a bill that is not a particularly strong bill. It does a lot of good things. But at the end of the day, if we are serious about comprehensive, universal, cost-effective health care, the only approach is a Medicare for all single-payer bill. This is certainly not that. I have also said that it is not my intention to be voting for legislation which doesn't have some strong cost containment components, and a public option is one way that you keep the private insurance companies honest. Now, what's going on right now is 10 senators, 5 more progressive members and 5 more conservative members have been kind of locked in a room working on some agreement. What I think I can say, that one of the ideas that is being looked at, as you have just indicated, which is not insignificant, is saying to people who are over 55 years of age, and many of those people have financial problems, and the older you get, the more illness you have. what this plan may be saying to those folks is you can opt in to Medicare on a premium-based way. You're going to have to pay a premium, but you will be eligible for subsidies depending on your income. That is not insignificant. Furthermore, I think that they are looking at various state options, giving states more flexibility as to how they can provide cost-effective health care to all of their people. So what you're looking at, Rachel, it is not fair, I think. I think it is not fair to simply say they are abandoning the public option. What you're looking at is trade-offs, which in fact at the end of the day may be stronger than the very weak public options that both the House and the Senate have already passed.
Let me ask you just a clarifying question, though, about these trade-offs. I absolutely hear you in terms of the progressive nature of expanding Medicare to be available to a larger group of people. Medicare, after all, is a single-payer system, and it is the sort of thing that progressives and people very concerned about cost containment have talked about doing for health reform. I understand why something like that might be a boon to progressives who'd be asked to be trading away something like the public option that at least ideologically makes a lot of sense. I don't understand how a government-managed, essentially, menu of private insurance options is a progressive choice. Why that would be something that progressives would be satisfied with and might even give up the public option in return for.
Well, you're right. The problem is what we are looking at is a very conservative institution. The Republicans have decided that despite the disintegration of our health care system, they're more interested in representing the private insurance companies than the American people. They're out of the picture. So you're down to 60 people, including some pretty conservative people. So I think what's going on in that room is trying to do the best that they can do within that context. The other part of the trade-off, by the way, may also be an expansion of Medicaid. And if you add to Medicaid the development of many new community health centers, you will be providing a lot more health care access to low-income people. If you do an opt-in for people 55 years of age to Medicare, you're also providing a significant benefit. So the details, it's difficult for me to give you an explanation because nobody really has the final word on what's going on. But what you're looking at, again, is a trade-off, expanding Medicaid, opening up Medicare to millions of more people, and weakening the so-called public option.
Independent Senator Bernie Sanders of Vermont, thank you for helping us try to figure this out tonight as this is breaking right now. Really appreciate it, sir.
You're welcome. Thank you.